Waking up from surgery, you expect certain things: pain, discomfort, and the need for plenty of rest. It's a period of recovery, where your body is focused on healing and getting back to its normal state. You're prepared for the challenges that come with the healing process. But one thing you might not anticipate is weight gain. Many patients are surprised, confused, and even frustrated when they step on the scale post-surgery and see the numbers going up. It can be disheartening. It's especially perplexing to see the scale rise, even while you're eating less than usual and moving far less than you normally would. You might be thinking, how is this even possible? The truth, gaining weight after surgery is a surprisingly common experience. And the good news is, it's usually temporary. It's not necessarily a sign of anything going wrong. Your body is healing from what it perceives as a controlled trauma, the surgery itself. It's working overtime, using every available resource to repair damaged tissues and get you back on your feet. This process requires energy and fluid, so most of the post-surgery weight gain you're seeing isn't actually fat accumulation. Instead, it's largely your body temporarily holding on to fluids and resources that it needs to facilitate the healing process. Think of it as your body's way of ensuring it has everything it needs on hand. This is a normal phase of recovery, not a setback in your overall health journey. Try not to get discouraged. During this time, progress should be measured by things like reduced pain levels and increased mobility as you start to move around more easily. Focus on those improvements, not just the numbers on the scale. The scale doesn't tell the whole story. Understanding the reasons behind this temporary weight gain can significantly ease your mind and reduce anxiety. It will also help you stay focused on the activities that truly support your recovery, like gentle exercise and proper nutrition. So, let's break down the science behind this normal and temporary change in your body weight. Understanding the physiological processes at play can empower you to navigate your recovery with greater confidence and peace of mind. Knowledge is power, especially when it comes to understanding your body's response to surgery. And that's especially true when it comes to your health and well-being. Being informed allows you to make better decisions and feel more in control. Remember, your body is doing exactly what it's designed to do in this situation. It's prioritizing healing and recovery, and that's the most important thing right now. Undergoing surgery is a significant event for your body. It's a carefully orchestrated process, but it inevitably triggers your body's emergency response, a cascade of reactions designed to protect and heal you. This response is primarily characterized by inflammation. It's a natural and essential part of the healing process. Healing cells, the body's dedicated repair crew, and fluids rush to the surgical site, flooding the area with the necessary components for tissue regeneration and repair. This influx of fluids causes swelling and water retention, which can be noticeable in the days following your procedure. During inflammation, blood vessels in the affected area become more permeable, essentially leaky, letting fluid move out of the bloodstream and into the surrounding tissues, contributing to the swelling you experience. This fluid shift leads to temporary weight gain, which can be concerning if you're not aware of the underlying cause. Furthermore, IV fluids are often given during surgery to maintain hydration and blood pressure. These IV fluids add even more water to your system, further contributing to the temporary increase in body fluid volume. It's important to remember that this isn't fat. It's primarily water, a temporary accumulation of fluid in your tissues. It's a sign of active healing, an indication that your body is working diligently to repair the surgical site. Your body strategically holds onto this fluid to support tissue repair, providing the necessary environment for cells to regenerate and rebuild. While uncomfortable, causing stiffness, throbbing, and limited mobility, this swelling is a necessary and beneficial part of the recovery process. As inflammation gradually fades, typically within a week or two, your body naturally releases the extra fluid it has been retaining. Your kidneys efficiently process it, filtering the excess fluid from your bloodstream. As the fluid is eliminated, the weight drops naturally, often resulting in a noticeable decrease on the scale. So, remember, that higher number on the scale in the immediate post-operative period is simply proof that your body is working hard to heal and recover. It's a temporary phase, a normal physiological response, and definitely not a permanent change in your body composition. After surgery, rest is essential, but it slows your metabolism. Less movement means fewer calories burned, even if you're eating less. This can lead to a small increase in body fat if recovery is long. Inactivity also causes muscle loss, which further lowers your metabolic rate. That's why gentle movement, as soon as your doctor allows, is so important. Even small exercises help maintain muscle and support metabolism. Don't feel guilty about resting. Healing comes first. Just be mindful of your body's changing needs. Focus on nutrient-rich foods to fuel recovery without excess calories. Work with your body, not against it, as you heal. Medications after surgery can sometimes have unexpected effects, like steroids and even common painkillers, can unfortunately contribute to weight gain. Steroids, for example, may significantly increase appetite and also cause fluid retention. Pain meds, on the other hand, can slow down digestion, potentially causing uncomfortable bloating and constipation. Furthermore, antibiotics can disrupt the delicate balance of gut bacteria, thereby affecting both digestion and weight. Thankfully, these effects are usually temporary and definitely not a sign of personal failure. Never abruptly stop any medication without first consulting your doctor's advice. If you're genuinely concerned, talk openly to your healthcare provider about any side effects. Open communication ultimately helps you manage your recovery journey with greater confidence. Surgery triggers a hormonal stress response, especially cortisol. High cortisol can increase appetite and encourage fat storage. Stress hormones also cause your body to retain water. Temporary changes in thyroid and reproductive hormones can slow metabolism and shift weight. For women, surgeries like hysterectomy can cause sudden hormonal changes and weight shifts. These effects are normal and usually fade as you recover. Your body is rebalancing itself after a major event. Trust that these changes are part of the healing process. Recovery is a journey, and it's one you don't have to navigate alone. It's about reclaiming your well-being, step by step. You can actively support your recovery and feel better, both physically and mentally, with a few simple, yet powerful steps. These are changes you can implement in your daily routine to foster healing and renewed vitality. First, stay hydrated. Water is essential for countless bodily functions. It helps flush out excess fluid, which can reduce swelling and eases constipation, a common side effect of certain medications or inactivity. Next, support your gut health with probiotic foods. Probiotics introduce beneficial bacteria into your digestive system, aiding in nutrient absorption and overall gut balance. Also incorporate gentle fiber when you're able to eat solid foods. Fiber promotes healthy digestion and prevents discomfort. Move gently as soon as your doctor allows. Even small actions like short walks or stretches help improve circulation and boost your metabolism, which can be sluggish during recovery. However, don't push too hard. Listen to your body's signals. It's crucial to respect your limitations and always follow medical advice. Gentle movement also helps reduce swelling, a common issue after surgery or injury. Maintaining some level of activity, even light exercise, can prevent muscle loss, which can occur during periods of inactivity. If you're worried about weight gain, a natural concern during recovery when activity levels might be reduced, don't hesitate to talk to your healthcare team. They can reassure you, address your concerns, and offer personalized advice tailored to your specific needs and medical history. Remember, you're not just a patient, you're an active partner in your recovery journey. Every small, mindful step you take contributes to your overall well-being and makes a big difference in the long run. Healing after surgery isn't a straight line, there are ups and downs. Temporary weight gain is a sign of your body's powerful healing response, not failure. You're not alone, many people experience this. Focus on real milestones: less pain, more movement, better sleep. Your body is working hard to recover, give it patience and respect. Celebrate small victories and trust your body's wisdom. As you heal, inflammation fades, activity increases and weight normalizes. Be patient, healing takes time. Trust the process and know you're on the right path. You are healing and you will get there.